Okay guys, so now I'll teach you acute hepatitis. So just remember there are two common causes of acute hepatitis. One is your viral and second is your alcohol. So it can be viral hepatitis, it can be due to alcohol. So alcohol hepatitis we have discussed in a separate video. So here just I'll be dealing with viral hepatitis. So before moving to the discussion of viral hepatitis, I'll tell you what are different type of viruses and what are their properties. So if I say we have total 5 main hepatitis virus. So just I am writing this, I am making a table. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. So these are 5 types of hepatitis virus. Hepatitis A, hepatitis B, hepatitis C, D and E. And last is hepatitis E. So just try to understand this. Whatever points we'll consider from here, definitely you will get some questions in exam. So some of your microbiology, I know it's a boring subject, but we'll discuss some of the parts of microbiology as well. So just try to understand this. If I say first important thing, we need to compare this hepatitis A virus. If I ask you what is the family of hepatitis A virus, what is the family of hepatitis A virus, so this point we'll consider. The next thing, if I say next thing what I want to add here is this hepatitis virus is enveloped or non-enveloped. So is it having some envelope or there is no envelope? We call this unenveloped. We call this unenveloped, or sometimes we use the word naked. Naked means without clothes, without envelope. If I say third point which I want to discuss here is which of these virus will cause acute infection, which will cause acute illness. And if I say fourth thing is which will cause chronic illness, which will cause chronic illness. A fifth point which I want to ask you is which virus will cause cancer, which will cause chronic illness, which will cause cancer. So just I have written chronicity and cancer together because the virus which cause chronicity, that is the same virus that will cause cancer. Then if I say what else I want to discuss, I want to discuss what is the incubation period. If I say average incubation period of these viruses, right? Average incubation period, and then I can say we should discuss on the nucleic acid, whether it is DNA or it is RNA. So these are the points we need to revise. Don't worry, when I am here you don't have to worry. This table will be in your fingertips. Okay, so let's see. If I see the family, hepatitis A will include in Picorna viridi. Which virus we have? Picorna virus. If I say hepatitis B, this is your Hepadna viridi or Hepadna virus. Hepatitis C is your flavivirus. Flavivirus. D is your delta virus. Sometimes we call this delta or defective virus. And this E virus, this is your Hepaviridi. It is your Hepaviridi. The subfamily that we use is Calciviridi. Calciviridi. So family is clear. Picorna, Hepadna, Flavi, Delta, Hepa. Okay, so how to remember this? You can remember this by a simple mnemonic. That mnemonic will be PH full dangerous hai. PH full dangerous hai. So pH is extremely dangerous. So pH full dangerous है. Picorna, Hepadna, Where student make mistake is, understand this, calci is not C. Clear? Calci is E. So don't think C for calci, C for hepatitis C. Okay, if I say which is enveloped, which is non-enveloped, let me tell you one more thing we need to discuss. These things we'll discuss, let us discuss together. One more point which I add here is which virus is spreading by which route, right? So if I say route for hepatitis A and hepatitis E, they will spread by fecal-oral route. So I am writing here FO. FO means fecal-oral route for hepatitis A and hepatitis E. Fecal-oral route. So understand this. For other viruses, what I will write, B, C and D, they will spread by blood. Clear? Hepatitis B, C and D, they are spreading by blood. So if I say fecal-oral route, how to remember this route to understand this? Family is clear? pH full dangerous. So we have hepatitis A and E. A, E, I, O, U. IOU we don't need. But what these are? This A, E, I, O, U, these are vowels. Right? So remember, this vowels will hit the vowels. Vowels will hit the vowels. Simple. Hepatitis A and E, this will spread by fecal-oral route. So remember, always vowels hit the vowels. B, C, D, these are consonant. And remember this full hepatitis, vowels hit the vowels nakedly. Nakedly means these two will not have any envelope. Clear? So simple. If I say, now come to this, enveloped or non-enveloped. So where I will write non-enveloped. So non-enveloped is your, or unenveloped. Let me write unenveloped. So I am writing UE. Unenveloped I will write where? In hepatitis A and E. Clear? If I say here, what I will write? In these three, where I will write enveloped. Simple. So hepatitis A and E, these are naked virus, naked or unenveloped. Okay, now if I ask you a question, which of them will cause acute infection? Now you are saying, sir, A and E. I have not asked you a question which is causing chronic infection. Acute infection can be caused by all virus. So all can cause acute infection. Simple. Acute infection you can see with all virus. Hepatitis C is, in majority cases, it is chronic, but it can also be, in very rare cases, it can be acute. So remember, acute diseases can be seen by any of the virus. But if I talk about chronicity, then remember, chronicity is a feature of hepatitis B, hepatitis C, and sometime with hepatitis D. So I am writing plus minus. Chronicity is not seen in A and E. Clear? Same is for cancer. Same is for cancer. So which hepatitis can lead to cancer? Hepatitis B and C, sometime D. Clear? If I talk about median or mean incubation period, then remember, here you will remember 30 days. 30 days is incubation period for hepatitis A. Then remember 60 days for hepatitis B. 50 days, 60 days again, 40 days. So this is an average incubation period. Remember, 30, 60, 50, 60, 40. If I say nucleic acid, for nucleic acid, remember, there is a song, there was a song a couple of years before, BD Jalaile. BD means BD. BD means hepatitis B is having DNA. So BD jal gay. Only B is having DNA, others are having RNA. So only hepatitis B is having DNA, others are having RNA. So in a simple table, I have discussed all different types of hepatitis. right? So hepatitis A, B, C, D, E. So these are different type of hepatitis. Now we'll discuss about acute hepatitis. Then remember, if I ask you a simple question, most common cause of hepatitis, most common cause of acute hepatitis overall and in children. The most common cause of acute hepatitis overall and in children, the answer is hepatitis A. So most common cause of acute hepatitis overall and in children, because this hepatitis A is mostly self-limiting. If I say most common cause of fulminant hepatitis, most common cause of fulminant hepatitis means patient is having acute liver failure. In that case, remember, the answer is hepatitis D. Hepatitis D. But if the same question, if I add in pregnant population, in pregnancy, which causes hepatitis or fulminant hepatitis? So remember, this is hepatitis E. So pregnancy hepatitis E is most common cause of fulminant hepatitis, right? Most common cause. So if I ask you overall hepatitis D is more common than hepatitis E in case of fulminancy. Now we have two main type of acute hepatitis A and E. So that we'll discuss here. Hepatitis D, B, C, D management we'll discuss in a separate video. So here what I am dealing with two main hepatitis. One is hepatitis A, second is hepatitis E. Hepatitis A and hepatitis E. So first try to understand this. I told you the name of virus, family, everything I told you, so I'm not going to repeat those things. What I'm telling you here is hepatitis A, this is most common cause of acute hepatitis. It is most common cause of acute hepatitis, right? If I talk about this hepatitis, how it is spread, so remember the route of spread is fecal-oral. So if I say how patient will complain, so mostly you will see patient will have, either patient is asymptomatic or there will be mild symptom, or there will be very minimal symptom, mild symptoms like there can be right upper quadrant pain, so minimal symptoms. And if I ask you for diagnosis, we can find this hepatitis A virus antigen, but the problem is generally we don't, because it's self-limiting. So if I say treatment is self-limiting, self-limiting means what we can do, if we can just give a good diet to patient, if patient is hospitalized, then we can give IV fluid, right? So we can give dextrose. So we can use 10% dextrose as an IV fluid. So understand this, if I say hepatitis A is most common cause of acute hepatitis and generally this is asymptomatic. Like if I ask you a simple question, how many of you had jaundice in childhood? So you will say a lot of people may have jaundice, right, in past. That was not jaundice. Remember, jaundice is not a disease. Jaundice is a symptom of disease, right? So what we had in childhood was hepatitis A. So like there is a common practice in India, whenever we get hepatitis, what we do, we go to some babas or some hakims. What they will do, they will give you some prashad or bhabhuti, or they'll give you jhad phuk and you are treated, because they are knowing that this type of hepatitis is self-limiting. In few days, like in 4 or 5 days, you will be automatically treated. So there is no point of giving any medication. Is it clear? That is about hepatitis A. If I say the last point about hepatitis A, the last thing about hepatitis A is vaccine for hepatitis A is available. Hepatitis A vaccine is available, right? So like we have few vaccine, just name I'm writing that Havrix, Twinrix. Havrix, Twinrix vaccines are available. So we give 2 doses of intramuscular vaccine 6 to 12 months apart. So these are given like 2 doses 6 to 12 months apart, right? Then if I say for pre and post prophylaxis, pre and post exposure prophylaxis, pre and post exposure prophylaxis, especially post exposure, what we can give? We can give hepatitis A immunoglobulin. Hepatitis A immunoglobulin. So remember, hepatitis A is generally self-limiting. Okay, if I talk about hepatitis E, so which is our next thing, hepatitis E, if I say hepatitis E is also a common cause of acute hepatitis. Okay, before E, let me tell you some important thing. I told you with A. With A, what I told you A for remember a little. So remember how to remember this. With A, remember A for a little symptom or asymptomatic, right? A for asymptomatic. If I say hepatitis E, remember E for expectant. E for expectant means good news. Expectant means in house there is a good news, some new one is coming. That is, this is most common cause. It is most common cause of fulminant hepatitis or dangerous hepatitis in pregnancy. Second thing is, it can also affect immunocompromised patient. So generally hepatitis E, understand this, it is not a dangerous infection in non-pregnant or non-immunocompromised patient. That is what you need to understand. In a non-pregnant and non-immunocompromised patient, hepatitis E is not dangerous. It is extremely dangerous in case of pregnancy, right? So just I am writing second point here is, it is not dangerous. It is not dangerous in non-pregnant and normal, or I can say, or non-immunocompromised patient. For example, I can say HIV patient, this could be dangerous, but in non-HIV patient it's normal. If I say the route of spread is same for both. They both are spreading by fecal-oral route. So here I am writing the same thing. So route will be fecal-oral route. Then if I say for difference, I can say treatment. I can say treatment in case of a person like me or a person like you, non-pregnant, non-immunocompromised, it is self-limiting, right? It is self-limiting. But in immunocompromised patient, or sometimes it is when it is not, suppose you are trying to treat this, it is not getting treated. In that case, what we can add? We can add ribavirin. We can give ribavirin. So ribavirin is given. So in most cases it is self-limiting. Otherwise, if it is not being healed, then what we can give? We can give ribavirin. I told you vaccine is available for hepatitis A. For hepatitis E, vaccine is still not available. So this is also an MCQ that they ask in exam is, vaccine is not available for which virus? Hepatitis E. So see what I told you. I have discussed hepatitis A, most common cause of acute hepatitis. Hepatitis E, most common cause of fulminant hepatitis, right? It's also, I can say one more thing I can just add is hepatitis E. This also, we have, if I ask you a question, maximum cases of acute sporadic hepatitis. So it is most common cause of acute sporadic hepatitis. Then answer will be hepatitis E. Is it clear? Then answer will be hepatitis E. And if I say most common cause of acute hepatitis, or better term is acute viral hepatitis in adult, then answer is also hepatitis E. So don't confuse this, understand this. Overall most common cause of acute hepatitis, hepatitis A. If I say most common cause of acute viral hepatitis in children, hepatitis A. In adult like me and you, it will be E. But it is not dangerous in you and me, it is dangerous in pregnancy. Is it clear? So remember once again, overall most common cause of acute hepatitis A. So mainly children are affected. If I say most common cause of acute hepatitis in children, again answer is A. Most common cause of acute hepatitis in adult, it is E. Sporadic hepatitis, it is E. Fulminant hepatitis in pregnancy, it is E. Fulminant hepatitis, overall the answer will be hepatitis D. Clear? So this is about how we manage the patient, right? So this is about your hepatitis E. Like some of you, like if you think vaccine, like yes, I have also heard in many countries vaccine is available, but in our country vaccine is still yet to be approved. So in India we still don't have vaccine for hepatitis E. Remember this one thing, that is called ribavirin. So this is about your acute hepatitis. Remember the simple table and don't forget, vowel hit the bowel nakedly. Simple. I hope you like the video. See you in the next video with chronic hepatitis. Thank you so much. Bye bye.